morning, doctors and friends. We are from SGD 1 and we are going to present our student project about alopecia areata. This is our group members. So, alopecia areata is a kind of hair loss in humans that affect hair follicles, nails, and retinal pigment epithelium. It is an autoimmune illness with a very generally relapsing course that can be chronic. Alopecia areata affects 0.1 to 0.2% of the population, with a lifetime risk of 2%. In alopecia areata, the immunological privilege of the anagen hair is violated by CD4 and CD8 T cell, resulting in the loss of the developing hair shaft. Genetic infection, trauma, and psychological stress have all been cited as a possible cause of alopecia areata. This illness has few treatment options with no cure, and psychosocial assistance is an important aspect of alopecia areata management. And based on our explanation above, this student project is proposed to improve the knowledge about alopecia areata. This is our research question and our research objective and our benefit of the research, which to improve our knowledge and deepen our understanding about alopecia areata.
The definition of alopecia areata. It is an autoimmune disorder characterized by scurrilous hair loss and maintenance of hair follicles. It is also often known as an acute onset hair loss, usually found with well-demarcated lesions. Hair loss can take many forms, from obvious partial loss to diffuse or total hair loss, which can affect the location of any hair follicle. It is also a type of alopecia affecting hair follicles, nails, and rarely retinal pigment epithelium. Areata refers to the areas AA usually forms, a key difference from other types of alopecia. Several types of alopecia have been discovered, including patchy, totalis, universalis, incognita, ophiuchus, decipho, and Marie-Antoinette syndrome. The patient will experience several types of alopecia chronologically as the disease progresses. It is also good to note that AA is a type of condition that represents an organ-specific autoimmune disease closely related to genetic or familial background.
Okay, thank you for the chance to given to me. My name is Rafael Kurnia Pratama Topan with the last three-digit number of my student registration number 055. Okay, I'll explain about the epidemiology of alopecia areata. Based on a meta-analysis study, alopecia areata affect about 2% of global population. Based on its study, alopecia areata prevalences increased over time. In other journal, alopecia areata is said to be more likely to affect non-white ethnicity, especially in Asian ethnicity. But unfortunately, there's no valid data about the prevalences or epidemiology of alopecia areata in Indonesia. Okay, that's all from me. Thank you.
My name is Dewan Putasari, student number 125. I'll explain about the etiology and the risk factors of alopecia areata. Alopecia areata is an autoimmune disease and mostly caused by genetics. Atopic disease such as allergies can also increase a person's risk of experiencing alopecia areata. There are also several environmental triggers such as emotional or physical stress, it's the most common, vaccination, febrile illness, medication, and diet.
Hello, my name is Shetimoto Kurnia with last three digit of student number 006. So the physical appearance of alopecia areata can be varied from receding hairline, hair breakage, and crown diffuse hair loss. And the alopecia areata is different from other scarring alopecia areata such as the lichen planopilaris, frontal fibrosing alopecia, and other scarring alopecia. And in fact, the alopecia areata is classified into the non-scarring alopecia, and it is the second most frequent non-scarring alopecia. The alopecia areata can be classified into 7 types. The first type is patchy alopecia areata, which can be manifested into single, multiple, or reticular patches of hair loss. And the second type is alopecia totalis, which can be seen when there is a total or almost totally loss of the scalp hair. Next is the third type of alopecia areata, which is the alopecia universalis. This alopecia areata can be seen when there is a total or near total loss of hair on every hair body surface. Next is the fourth type, is the alopecia incognita, which can be manifested when there are diffuse total hair loss and there is a positive result for the hair pull test, the appearance of yellow dots, and this alopecia areata comes without the nail involvement. Next is the fifth type, which can be called by ophiasis, and this is where when there are band-like hair loss along the head circumference, especially on the temporal and the occipital bone. Next is the sixth type, which can be called by Sisypho, and this is when the alopecia areata can be described by an extensive alopecia around the scalp peripherals. And lastly, the seventh type of alopecia areata is the Marie Antoinette syndrome, or also can be called by Canitis subita. And this alopecia areata can be defined by existence of acute diffuse alopecia episode and overnight graying with a pigmented hair preferential loss. Thank you.
My name is Jeremy with student number 083. Today I'm going to explain about the histopathological findings of alopecia areata. Clinically, alopecia areata diagnosed when patient come with non-scarring, well-demarcated and localized area of hair loss. In some cases, punch biopsy needs to be done. Histopathological findings of alopecia areata varies from acute, subacute, chronic, and recovery phase. In the early stage, there is a robust inflammatory infiltrate surrounding the hair bulb located in the deep subcutis. It consists primarily of T cells, but Langerhans cells, eosinophils, mast cells, and plasma cells can also be found. In acute stage of alopecia areata, both vertical and horizontal sections of the scalp biopsy shows a peribulbar and intrabulbar infiltrate. In the subacute stage, there's a horizontal sections reveal an increase in number of catagen hairs. The number of telogen hairs also continues to increase, and at the same time, the terminal hairs decrease and the vellus hair increase. The chronic stage of alopecia areata shows chronic peribulbar lymphocytic inflammation around the condensed hair located in the papillae dermis, and the recovery stage of alopecia areata is characterized by condensed hair that grow back into terminal hairs with little or no inflammation detected. Thank you.
Hello, my name is Rismanania, number 105, so I'll explain about pathophysiology of alopecia areata. Alopecia areata is a disorder of hair follicle cycling, where inflammatory cells attack the hair follicle matrix epithelium that is undergoing early cortical differentiation, which are then prematurely induced into the catagen phase. The condition occurs when white blood cells attack the cells in hair follicles, causing them to shrink and dramatically slow down hair production. It is unknown precisely what causes the body's immune system to target hair follicles in this way. However, since no destruction of hair follicles, the hair follicle retains its capacity to regenerate and continue cycling. Thereby, follicles re-enter the anagen phase normally, but do not develop beyond the anagen 3 or 4 phase. Thank you.
Since only anagen hair follicles undergo attack, those autoantigens may generate and then be presented only during anagen. But the exact pathophysiology of this disease is currently unknown. However, some triggers have been reported it can cause by an autoimmune reaction to both genetic and environmental factors, most commonly emotional or physical stress. It can also cause by vaccines, viral infections, and drugs.
Hello, my name is Putri Indria and my last turn number is 200, and now I'm going to talk about the diagnosis and differential diagnosis for alopecia areata. The first is diagnosis. In order to diagnose alopecia areata, we have to perform physical examination as well as histopathologic examination. In physical examination, the patients who have alopecia areata will show some signs of hair loss, and the pattern is well circumscribed patches, and if it happens on the head, it will show the skin of the scalp. Second is histopathologic examination. In histopathologic examination, it will show some dense lymphocytic infiltrate that is called B-swam pattern in the anagen hair follicle. And several differential diagnoses for alopecia areata can be: one, traction alopecia; second is aplasia cutis; third is tinea capitis; and secondary syphilis, temporal triangular alopecia, and trichotillomania. That's all I can say. Thank you.
Hello doctor and friends, my name is Nilyondari and I'm gonna explain to you about the treatment and management for alopecia areata. So currently the treatment and management in alopecia areata is divided into two categories, which is under age 10 and over age 10. So the first one is under age 10. Usually we use topical corticosteroid with minoxidil 5% and or antralin. The second one is overextend. It is depend on extent and activity. There are several phases. The first one is patchy active phase. In this condition, we can use intralesional and or topical corticosteroid or systemic corticosteroid, but we use it as only if we need it. The second phase is patchy and chronic phase. We usually use topical immunotherapy or minoxidil 5% with anthraline or topical immunotherapy with anthraline. The third phase is severe active phase. We usually use topical corticosteroid, which is under occlusion, or systemic corticosteroid, or methotrexate and azathioprine. The last phase is severe chronic phase. Usually we use topical immunotherapy or topical corticosteroid under occlusion. That's all from me. Thank you.
My name is Christopher Yongasa, student number 172. I'll explain about the prognosis and complications. The course is unpredictable. The patient's recovery may be complete or partial. Potential indicators of poor prognosis in patients with alopecia areata may occur if the patient has a family history, younger age of onset, immune disease, nail dystrophy, atopy, and extensive hair loss. More severe and persistent alopecia areata will cause complications, psychosocial consequences such as depression and anxiety, baldness, atopy, vitiligo, thyroid disease, and other autoimmune diseases.
My name is Inyuman Wigahayoga with NIM 109. I will explain about the summary of alopecia areata. Alopecia areata is acute hair loss characterized by scalous hair loss and maintenance of hair follicle. To eliminate the differential diagnosis, pan biopsy can be used. Alopecia areata occurs when inflammatory cells attack the hair follicle matrix epithelium. Particularly, the white blood cell will attack the cell in hair follicle, disturbing the cell and cause them to shrink and slow down hair production. In physical examination, the examiner will check the sign of hair loss and note hair roots. For the histopathologic examination, the examiner will check for dense lymphotic infiltrate B-swamp pattern in anagen hair follicle. The sign for bad prognosis in family history is family history of alopecia areata, younger age of onset, immune disease, nail dystrophy, atopy, and extensive hair loss.
Okay, that's all from us, SGD B1. Thank you for all your attention and have a nice day.